gender synchronized approaches and approaches which engage men and boys, addressing gender-based violence, and really trying to close some of the gender gaps among youth in order to promote gender equality and also to improve adolescents' overall psychological well-being. And so this year, the focus is on key populations. And that focus started because one of the gaps found in the systematic review was that there was very limited information on programming amongst LGBTQI, among disability, among married girls, and also about strategies of effectively engaging men and boys. So this is the reason why some of our webinars and in-person meetings are going to be focused on these issues. And so today, we're going to discuss research and programming strategies to engaging men and boys. Some of the highlights that we've done as a COP is that we've produced a checklist that development practitioners can use to talk about how to integrate gender into program design, implementation, and evaluation. We also recently produced a technical brief that's focused on PYD programming as it relates to sexual coercion. Today, what we want is we want a very interactive discussion, not only on engaging men and boys, but also any thoughts that you have about potential topics or webinars or briefs that you'd like the Gender and PYD COP to produce. And so to get started on the focus of today, I'd like to introduce our moderator, Preston Mitchum. Thank you, Preston, for coming today. Preston is an advocate and activist who brings legal and policy experience to his role as International Policy Analyst at Advocates for Youth. At Advocates, he supports both policy and international youth health and rights divisions on the global sexual and reproductive health and rights in U.S. foreign policy portfolio. He also serves as adjunct professor at Georgetown University Law Center, teaching LGBT health, law, and policy. Press will be moderating our discussion today. Thank you.
Good morning, everybody. My name is Preston Mitchum, and I'm the International Policy Analyst with Advocates for Youth. I'm so happy to be here, and thank you to the organizers for this amazing in-person meeting and webinar. So today, we should really be excited because we have an embarrassment of riches of wonderful panelists today to talk about to talk today about gender equity in research and programming, engaging adolescent boys in men and boys for sexual and reproductive health and rights. So today, what are we really discussing? So it's an interactive panel discussing the need and some examples of strategies, tools, and messages that implementers have used to positively engage adolescents. The program will start with the state of evidence on reaching adolescent boys. We'll have on positive gender and sexual and reproductive health messages, and then transition to programmers talking about what messages and techniques they found most successful. So kind of the key lessons and strategies that we've learned, the best practices. And so you may hear a lot of that because it's the National Prayer Breakfast today, so we're going to have some great people, obviously, coming past while you may hear some noise, but we're going to kind of volume it out, right? We're always louder, so don't be distracted by that, right? Because we have some really good energy that is going to be in this room and online. All right. So the panelists that we're going to have today are, and they can definitely come up as start to be introduced, is Jill Gay, who's a Chief Technical Officer of Works Association, a US-based civil society organization whose mission is to transform the lives of women and girls by using evidence to improve policies and programs. We'll also have Ali Glinsky, who's a gender and evaluation specialist at the International Center for Research on Women. We'll have Nana Davidu, who's a senior research officer and instructor at Georgetown University's Institute for Reproductive Health. And last but certainly not least, online, we're going to have Brian Howman, senior research officer from Promundo. All right. Thank you. And while we're getting situated, pardon me, and while we're getting situated, one of the things, so all the panelists, you have 10 minutes each for their presentations. Of course, if there are minor questions about the presentations, definitely feel free to ask them as they're continuing going. But we do have 20 minutes actually allocated for question and answer. Of course, I'll start with one general question for the panelists, and then I know you all have a lot of questions based on the presentations and conversations, so then we can just jump in during those 20 minutes. Does that sound good? All right, thank you.
How do I just click? Yeah, those are better. Thanks. Hi. Actually, you know what? Sorry, I'm going to go sit down because I won't be able to see over the podium. Yeah, I need to clicker. Thanks. So, I'm here to talk about the evidence. And so I'm going to start with this document from UNESCO, and everything I'm talking about is in the references, so I can put the citations and everything. But all the citations are at the end, and you'll be getting a copy of the slide. So this is some work I did for UNESCO with Joanna Harrod and Marina Tedesco, who's no longer with UNESCO, and it's early and unintended pregnancy in the education sector, evidence review and recommendations. And it's not, can you hear that? This thing doesn't seem to be working. Sorry, I can't hear online. Sorry. Sorry, guys. That's. Yeah. So I was saying that this is some UNESCO work on early and unintended pregnancy, prevention recommendations for the education sector. And can you go to the next slide?
Working on it. There we go.
Yeah. So when we looked at this issue, what came out were some really strong gaps. That we know that adolescent boys who become fathers at an early age suffer also from school dropout, not just the girls, and they also suffer from reduced life opportunities, and that involving boys and men in discussions about gender can have positive impacts on their sense of responsibility, their sense of empathy. But we did not find evidence on interventions on boys' involvement. That we found a few small-scale studies, like The World Starts With Me in Uganda, that was never scaled up, a very small study. Next. So then, with my beloved co-authors, Karen Hardy and Melanie Croce-Gallis, we did some work. Are men well served by family planning programs? There's also a Pop Council evidence working paper on this that has sort of gory details of all the programs we reviewed. But the answer to this question is no. Men are not, and boys neither, are not well served by family planning programs. They are completely omitted. Next. So we found just endless amounts of gaps in terms of adolescence. There's very little on reaching adolescent boys on contraception and HIV, including HIV, which I found astonishing. Not enough on gender norms, although you'll hear the fabulous work Nana's doing at SRH, which is really making a difference. Very little on how to navigate couple communication. For a boy first starting out on his first relationship, how do I do that? What's appropriate? What's not appropriate? There's not a lot of guidance out there or evaluated programs. How do we meet boys' needs while respecting the autonomy of girls? Another gap. And national policies that deal with SRH, including HIV, often leave out adolescent boys. And I need to amend this slide because it's not just research gaps disaggregated by sex, but disaggregated by sexual identity, as well as for the different ages, because we know that a 10-year-old has very different needs than an 18-year-old. Next. So since the article that Karen and Melanie and I had published on Are Men Well Served by Family Planning Programs, there have been a couple of advances, and this is one of them. This is something from IPPF and UNFPA, which is a global sexual and reproductive health services package for men and adolescent boys. But I have not found any evaluated evidence on it being rolled out, what the impacts are, but the content looks very promising. And then the most major advance is right before the end of 2017. UNESCO issued the updated sex ed guidelines, which are huge, a huge advance, because these sex ed guidelines, and we know that, so there's a global GEAS, help me out, Nana. The Global Early Adolescence Study, which is out of Hopkins, and the websites in the references, had a webinar earlier this month that showed that basically gender norms are entrenched by age 10. Some work I did in Senegal with Mary Faith Wancourt, thanks to Meg Green, who's in the back, showed that gender norms are entrenched by age 6. So it's, when we start thinking about gender norms, we need to move toward the life cycle and start early. I mean, perhaps we can only start with school age, but anyway, so we need a validated curriculum as soon as children start school. But here are some advances from these UNESCO guidelines. There's a learning objective noting that homophobia and transphobia are harmful and recognizing that all people should be able to love who they want. The curriculum discusses GBV, gender-based violence, another important advance. Here we do have important validated studies. So for example, there's the Good School Toolkit by DeVries et al. That documents work that they did in Uganda to reduce gender-based, school-related gender-based violence that showed it was effective. And SASA has been at the forefront globally of work around gender-based violence. So it's very exciting news that they're looking at different age groups. However, and there's also guidance from UNGAI on school-related gender-based violence, which is excellent guidance. However, as good as this is, the earlier sex ed guidelines were not rolled out. They're not rolled out in the US either, not just in the countries in which we work, in Asia, Africa, and Latin America. And so we don't know how many adolescents receive sex ed, the quality of the sex ed provided, and if it's actually effectively implemented. And by some fundamental metrics, we know sex ed is failing globally. So for example, in sub-Saharan Africa, recent survey data from 35 countries that only 36% of young men and 30% of young women correctly identified ways of preventing sexual transmission of HIV. which is astonishing. We've had this epidemic now for 30 years, and the fact that this is not universal knowledge is shocking, including the fact that this survey did not even include some of the more, quote-unquote, advanced HIV prevention methodologies, such as pre-exposure prophylaxis, voluntary medical male circumcision. And globally, UNAIDS has noted that most people lack the knowledge to protect themselves from HIV. And as shocking as that is, globally, most people lack the amount of knowledge young people have on how to prevent pregnancy is even lower. Yet we know from DHS data that many adolescents are sexually active by the age of 16. These guidelines note that a discussion of masculinity is largely absent from sex education programs, despite the fact that boys have questions about their sexuality. Few sexual education curriculum address same-sex relationships. Last slide. So why am I showing a U.S. survey? Because I know that, this audience, all of us work in Asia, Africa, Latin America, and the Global South. And the answer is because we do not have this data for the Global South. It's an example of the kind of data we need. We know, for example, that men who have sex with men or boys who have sex with boys and men and transgender adults are very high risk for HIV. And this survey in the US, with over 27,000 respondents, reported high levels of violence in every aspect of life. Almost 25% reported that they did not seek needed health care due to fear of mistreatment in the US. Hello, prayer group. A qualitative study of adult MSM and transgender people in Pakistan by my friend Tahir Khilji found that all of them faced discrimination, and 70% initiated sex prior to age 18, and of course recognized their sexual orientation prior to age 18. So following up on Chesina's point about we're missing data on key pops, we are particularly missing data on adolescent key pops. We do not have this data for adolescents, particularly adolescents in the Global South, where men who have sex with men and transgender people may face a death sentence for their sexuality or whom they love. And while PEPFAR has shined a necessary light on adolescent girls, adolescent boys are being left behind. Men and boys are not just partners. Men and boys have their own sexual reproductive health needs beyond HIV. We have not only a gap when it comes to adolescent boys in the evidence base, we have a chasm. As we say in Spanish, hay todo para hacer. So we as a field have a lot to do to meet the sexual reproductive health needs of all.
Just trying to get to. Okay.
My coffee. ¿Dónde se fue mi café?
How do we just do view slideshow? Where did it go? It's actually at the bottom. Why is it going? Sorry. We went to the end. Sorry, everyone. We have a lot going on. And now we're good.
Okay, thank you so much. I'm Allie Glinsky, a Gender and Evaluation Specialist at ICRW, and I'm going to be talking a little bit about a recent learning review that we did on male engagement programming. So Cartier Philanthropy approached ICRW to do this review because they were interested in funding male engagement programming, but they didn't really know what's been done, what works, what doesn't work, where are the gaps. So We did an extensive literature review, key informant interviews, and hosted a convening with experts to ensure that our findings were aligning with their experience in the field. And we've produced this brief, the picture there, there's copies over here if anyone wants one, and we can send the link. And we also will have a full report that we're releasing at the end of the month. And for those of you who want more findings, ICRW is hosting an event a week from today to kind of launch the report, so please come to that as well. So as we got into this review, we realized that we needed to first do some kind of conceptual framing around the key topics that underpin male engagement work. So first, empowerment. We define empowerment as access to resources, which is knowledge and skills, as well as power and agency, which is the ability to make and act on one's decisions. And while empowerment is important for all people, because women often are starting at a place of kind of disadvantage and disempowerment, empowerment is particularly important for women. Gender equality versus equity. So gender equality is the equal treatment of all people regardless of their gender. However, this fails to recognize that gender identity influences one's aspirations, opportunities, access to resources. So gender equity takes into consideration the diversity across all people, all genders, providing services and programs not despite one's gender, but in response to one's gender. And I have this nice picture you've probably seen before. The one on the left is showing equality. So each person is given the same treatment. But of course, because some of them are kind of starting from a place of disadvantage, this isn't enough to allow them to see the baseball game. On the right, we have equity, where kind of the treatment or the size of the box is in response to where the person is starting, and that's what creates equity. So these concepts made us think a little bit more critically about how we frame male engagement programming. Male engagement programming is often framed as for women's empowerment, and we were even thinking of it that way when we started this review, but that's, of course, very instrumentalizing for men because it's kind of using men for the benefit of women. We also often frame it as male engagement for positive masculinities and helping men not equate being aggressive or being the sole provider with being a good man. And while this is important and beneficial and healthy, it's missing part of the picture. We need to recognize that we all live within patriarchal power structures. We all uphold those structures, we're harmed by those structures, and we have a role to play in transforming those structures. So rather than male engagement programming for women's empowerment, we want to think about male engagement for gender norm transformation to create greater gender equity. And the final point, engaging men as co-beneficiaries, goes along with that. So it's not engaging men as stakeholders or gatekeepers or allies, but rather co-beneficiaries who have something to gain from this process. So through this review, we created these two conceptual frameworks. I know it's probably hard for you guys to review. I'll go over quickly, but also just know that these are tools that are in the reports if you want to delve in a little more deeply. So this first graphic maps the process of gender norm transformation to get to greater gender equity. And the second graphic that I'll show kind of layers male engagement on top of that as an approach, a strategy to achieving gender equity. So here, if we look kind of across the program strategies, we look at the individual, community, institutional, policy level. Some examples at the individual level, we have examine, question, transform definitions of masculinity and femininity. The community level, create collective action around equitable gender norms and behaviors. The institutional level, create more gender equitable institutions, such as the workplace, schools, health centers, justice system. The policy level, engage authority figures on creating more gender equitable policies. Then we go up to this process of change, which is the orange and turquoise, and often we think about first attitude change and then behavior change. But we realize that when it comes to social norms, sometimes it doesn't happen in that order. Sometimes first people change their behaviors kind of because they think they should. They're doing that to fit in. They're doing that because they feel that that's what they should do, but deep down they haven't really shifted. but it's actually the act of changing the behavior and behaving in that way that then influences kind of internal attitudes and beliefs. So it's this mutually reinforcing cycle that, one's not necessarily coming before the other. And then this all leads to, we have the categories of the benefits of gender equity experienced by women, men, families, and communities. And it's cut off on the right, but an important part to the right is we kind of said, this is the process of gender norms transformation. But one piece that's important to keep in mind is what we want to happen through this process is the deconstruction of the gender binary. So often we talk about men and women, and I'm doing that today as well. But we want to think about, when we're talking about gender norm transformation and gender equity, that we're thinking of gender as that spectrum and including everyone along the spectrum and creating equity for all. This next slide, as I said, is layering male engagement as a programmatic strategy onto that process of gender norm transformation. So a few examples at the individual level. We have trainings and workshops with men and women to negotiate behaviors. The community level, creating male champions, launching grassroots campaigns. At the institutional level, strengthening oversight. And at the policy level, engaging male policy figures, for example. And then here in the turquoise up above, we have kind of conditions of the enabling environment that then create those benefits. I won't go over them, but you can kind of dig in, like, what are the changes that happen to men, women, and communities that enable people to experience those benefits. And here, kind of that extra little piece to make sure we consider is at the top on the right, where it says accountability and complementary women's programming. So if this is the focus of male engagement programming, in order for male engagement programming to actually lead to gender equity, we need complementary women's programming going on at the same time. And also to ensure that the male engagement programming is accountable to the women's movements, women's needs, and women's programs. So in addition to doing this conceptual framing, we dug into kind of specific sectors. So we looked at economic empowerment, health, violence prevention, land and property rights, care and fatherhood, and a few others to see what, how is male engagement programming applicable in those sectors. And so I just wanted to provide one example from a violence prevention sector, which is Parivartan. This is a program implemented by ICRW in India. And it engages boys in sports and critical reflection through cricket. And so there's coaches that kind of serve as mentors to the boys and teach them to play the sport, but then also weekly engage them in kind of sessions where they talk about gender equity, challenges the boys are facing, and that sort of thing. And so some of the kind of best practices that this program exemplifies are targeting young men and boys, obviously, linking positive masculinities to culturally compelling gender identities. So by the boys having these coaches who they can relate to, who they see as a kind of cool older mentor, who are living out these gender equitable beliefs, they can kind of see that behavior reflected in something they aspire to. Also nurturing male peer groups that reinforce positive masculinities. So as boys kind of step outside of the norm and try these more gender equitable behaviors, they might experience pushback. Things might feel uncomfortable. And when they have a peer group who's kind of going through this process with them, then they have that support structure. So as far as best practices, we want all programming to think about how they can engage both men and boys and women and girls to achieve program outcomes. We also want to think about how using a gender equity frame might shift program objectives a little bit, but create more sustainable change. A few specific kind of top-line best practices that came out of our review are to use messaging that avoids a zero-sum game mentality, but sets realistic expectations. So we want to get away from, if she gains, I lose, but also understanding that as power dynamics shift, things will change, and people have to be ready for those differences. We want to recognize the intersectionality of other systems of oppression, power, and privilege. So not all men feel like they're in a position of power, especially men living in poverty, from marginalized groups, in conflict situations. So we need to recognize kind of where the men we're working with are coming from, the men and boys, and how to address that accordingly. Be accountable to women's programming, women's movements, and women's needs, at least at a minimum, making sure not to further marginalize women and girls. Start when boys are young and adapt through life transitions. Use gender synchronized approaches, which means working with both men and boys and women and girls both together and separately, so they have time for kind of reflection in both types of settings. Promote alternative positive masculinities, particularly those related to fatherhood and kind of men's roles in sharing household responsibilities and decisions. Use male role models and advocates that people can relate to, but also make sure that those individuals have really unpacked their own beliefs. Everybody comes with their own biases, and so if we're kind of using male role models in a program, we want to make sure that that individual has really unpacked their, and really kind of embodies those gender equitable beliefs. And finally, acknowledge and address institutional hierarchies. So we often think about norm change, or attitude and behavior change among individuals, but as I mentioned earlier, we're all situated within these patriarchal power structures, and so changing individuals isn't going to get us there. We need to think about kind of the societal and institutional structures that we operate in, and how can we create more gender equitable structures that will allow space for greater gender equity of individuals. And as I said, if you want to learn more, please tune in next week. Thanks.
Great. Good morning, everyone. It's an honor to follow both Jill and Allie, who really laid out the evidence that we have in this field. And I'm going to walk through a few of the examples and lessons that IRH has culled from our experiences implementing and evaluating some of these programs. So I want to recognize that at IRH, we actually have over 20 years of experience doing this work in various sectors, mostly in relation to family planning and sexual and reproductive health. But for the purposes of today, and since I only have 10 minutes, I will highlight 4 of these interventions. So the Gender Roles, Equality, and Transformations project that happened in northern Uganda, so post-conflict setting, with Pathfinder International and Save the Children as partners, along with 2 local organizations, Concerned Parents Association and Straight Talk Foundation. The Tekwanon Jikuagu project in Benin. Some of you might remember that it actually started in Mali and then due to unrest was transitioned to Benin. The third is Choices, Voices, Promises, which actually is a Save the Children intervention, but IRH was the evaluation partner on it. And then finally, Transforming Masculinities, which is a study under the Passages project that IRH is working on in partnership with Tear Fund and Église du Christ au Congo, or the Church of Christ in Congo. So you'll note that these obviously cover a broad geographic region, but all 4 to various extents aimed to address sexual and reproductive health, gender-based violence, and also gender equality. So the themes are similar, and in all cases, there were also multiple components that were working together within the same package. So just keep that in mind. I won't be able to talk much about each of the components for the projects, but we'll share a bit of the data and some of the information that highlights these male engagement aspects. Another main theme that the projects share and really wanting to highlight is that they are heavily grounded in implementation science. So not just a project to have a project, but really thinking through also applying data and evidence that we can use for scaling up, and also that we can use to inform other programs across various sectors. This is something that we pride ourselves on at IRH as a research organization, but clearly also just noting that the partnerships with implementers has been really insightful in making sure that the research is responsive to what people on the ground need and what programmers need as well in order to improve and advance programming. So, for the first lesson, just noting that men are not static or one-dimensional. They come in a varied of profiles. I think Jill and Allie both touched on this a little bit. And so it's really important to consider their particular needs, not just at one point in time, but also across the life course, and really thinking through the socio-ecological lens. So one way that we like to depict this a bit more visually, and Jill touched on the life course piece, and Allie touched on the socio-ecological quite a bit. So just to put this back in front of our minds, that really it's important to have these different perspectives. And in case you, for each of the projects, they sort of took slight different approaches to making these into reality, but all had this in mind. And I think the important thing to note here is that there are great opportunities as men, as individuals generally, but in this case, of course, the men, as they go through puberty, as they go into romantic relationships, marriage, and then transition onto parenting, there are opportunities really to effect transformation and for themselves as well as their communities. And so bringing in that socio-ecological piece as well. Maybe just to note, this is the gender community of practice, obviously also that there is an intersection not just of these different life stages, but also between gender, violence, and then health broadly and sexual and reproductive health specifically. So a few different interrelationships going on. Here for choices, voices, promises, I just wanted to highlight that even designing materials and the strategies for the interventions are really critical in terms of dissecting. So you see that for the girls and boys, there is an actual manual curriculum. That was the choices component. For the family level, there was the voices component so that parents could sort of go along with what their children were learning in Nepal, and then a third level where there are materials for broader community engagement, which was the promises component. This is just another level of detail for this intervention. There were posters that were staged and to integrate often the tangible benefits and also the emotional benefits. So not just looking at health, but I think Allie mentioned this idea of co-beneficiaries. So really, how can they also find some good for themselves, and really highlighting those emotional and other benefits that they can find. The group support, I think something we note here and in other interventions, is this idea of community validation in coming from dialogue and critical reflection. So these posters tend to be a visual reminder or sort of a starting block for some of those discussions and dialogue to occur. The second lesson is that men also do not operate in a vacuum, clearly, and that really we found it helpful to identify and engage the men's reference groups in order to have sustained change. So the reference groups are the ones that are setting the norms, encouraging or inhibiting changing behavior or moving forward in the fact of norms. So I think just to highlight maybe quickly, I wanted to share Simon's story. Simon was a 14-year-old in the GREAT cohort study. We talked to 60 adolescents from 10 to 19 who were single, married, parenting, each of the cohorts over 2 years. So we interviewed them every 6 months. And this was one of the the individuals that participated in the study. So he sort of had started dating. We interviewed him when he was, I think he was 13 or 12. This might be when he had already done a couple of interviews, but he had started trying to think through at school, thinking through relationships, and wanted to work around his family and sort of community struggles, right? He had his own internal transitions through puberty, but then also dealing with a post-conflict setting and what his relatives were experiencing as well. As he was going through these changes, he was also concerned about what his friends were doing, which is natural for an individual, a boy this age, right? And so just highlighting in this case that Simon, while we could, work with Simon with the puberty flip book, we also needed to work with him in a group, so a group setting in his club, as well as with the community at large through some community sensitization, because the family, the neighbors, and the peers are people or groups that he's highlighting as where he looks to for guidance in terms of the norms. This one might look a little busy, especially for those of you that aren't as much into evaluation, so I will just walk you guys through it. This was from the Transforming Masculinities intervention in Kinshasa, and what we found here is that examining the reference groups was even important by outcome. So not just looking at reference groups in general for the men, but also by the specific outcomes. So we have these sort of tranches for women and men, also for family planning, and for masculinities in general. But I wanted to highlight this violence one, first of all, because we see that all of these were statistically significant, but also to show that, for both the men and the women, that there are differences. We can't just say, oh, these are the key agents of change or holders of the norms, but we have to look across men and women. Where are these people going? So you can see that you have the partner, mother or mother-in-law, the faith leader, and then father or father-in-law. And you can see sort of the men are looking primarily to their faith leaders and their mothers or mothers-in-law. And the importance of that is really thinking through how we can work with the congregations or these reference groups within the congregations where we're working, so that they are simultaneously hearing messages and getting to talk through the same things that the men are hearing in the community dialogues with their wives or partners. And so this, I think it's just highlighting a bit the importance of actually seeing who is driving the norms and who can help to drive the change as well. Just quickly then sharing a slide from the Tekwanonjikwagu project. This is also looking at the exposure to the intervention. You see that there are differences between the men and the women. But highlighting here, we found that one of the interventions, the radio, a lot of the call-ins to the radio drama were coming in from men. But while we wanted there to be positive norms, sometimes the men were actually reinforcing negative norms. And so as programmers, in the beginning, the team had to figure out how to make adjustments to that, and whether we're using the radio DJs or other reinforcements in the communities to bring back the focus to the positive norms. So I'm running out of time, so I just want to go to the third lesson, which is planning long-term. So really avoiding sort of just lots of little pilots and making sure that we are beginning with the end in mind. And this is mostly coming from the ExpandNet framework, but the importance of really not just designing materials that can be adapted and scaled up, but using strategies that really foster what exists in the communities, because the norms are from the community, and so what can be transformed, what can be scaled up, comes from within as well. And so using the groups that are already in place, that can already move the barometer locally, and then targeting those local strategic actors, and obviously for scale up, making sure that people don't feel that it's a burden, so they can use minimal orientation and coaching to implement the project, and then being able to monitor that also in a light enough way where the community is engaged. Just the last slide here, showing how we applied this in GREAT. So in the GREAT project, we designed right from the beginning by involving the community and local government so that they would be involved from the start and be able to move on with the intervention once the project closed. And so the blue areas were where we started the pilot for 2 years and then moved on to the 2 green districts where they implemented the full 4 components of the intervention. And then we also, in the 2 gray districts, worked with FHI 360 in their APC project to only work on the service linkages component. And so really covering over a 2-year period, quite a bit of northern Uganda. So just an example of that beginning with the end in mind. And if you're curious to hear more, obviously we can talk here, and I'm happy to answer emails as well. So, thanks.
Hi everyone, can you hear me? Oh, this is gonna be awkward. I want to make sure that you can hear me before I start.
Can hear you.
So maybe someone just start applauding or give me some kind of affirmation. Can you hear me?
We can hear you, Brian.
Oh boy, well, good. I'm sorry for all the
Can hear you,
glimpse of my desktop and all the behind the scenes here, but great. So no, I can hear you. Thank you. I think there might be a little bit of a delay, but I know we're short on time, so I will keep zooming forward. I really appreciate the opportunity to step in place of my colleague Ruti Levtov at Promundo. She had a different situation come up this morning, and so I really wish I could be there in the room with you all. It seems that there are a lot of dear friends and colleagues there. I'd love to catch up with a lot of you, but I am based in Minnesota these days, and so I'm calling in from the snowy Midwest to add just a few additional ideas to our conversation today about this organizing question that hopefully you see on your screen. How does society let men act? And that comes from some qualitative research we've done recently, actually within the US, that I'll be pointing to as we go. So a quick overview for anyone new to Promundo. We are in our 20th year now of conducting research programs and advocacy, working toward gender equality and a world free of violence, and particularly men's violence against women, all around the world, working in all 6 of these areas, from fatherhood to conflict to economic justice, quite a lot of work on violence. I sit in our research team, and quite a lot of work, of course, with youth inequality. The picture you see there is the kind of founding location of Promundo in Rio de Janeiro, where we still maintain a consortium partner office. But I think in addition to all the really fantastic program insights that people have offered already this morning, I think probably what I can do is really open up the box, as it were, about what exactly are these harmful norms of masculine identity and of what being a real man means. And so if I could just ask everyone to indulge me in a classic classroom activity that we often do in these spaces. What are some ideas, some phrases, some words that come to mind when you hear the phrase, be a man, or man up, or be a real man? Just take a second, see what comes to mind. Of course, these identities are very diverse, and we want to be moving toward a world where every single person, regardless of their gender identity, can express that identity in every way that feels authentic to them. But too often, in too many places around the world, being a man is associated with the kinds of messages here in the man box. And I've highlighted in red some of the ideas that relate specifically to today's theme about sexual and reproductive health and rights. To be a real man, you have to have a lot of sexual experience. You can never show any weakness. You can never show any emotional vulnerability other than anger. And of course, when we're talking about being a real man and pursuing a sex life, this has to be on the narrow script of heterosexuality as well. And if you fail to meet the set of impossible to achieve standards and fall outside of this box, then society and your peer groups and social messages would really reinforce that you're failing by calling you some other names, pushing you back into the box, by telling you that you're failing to meet these expectations. And I think what we all recognize working in the field that we work in is that this situation is problematic in a lot of ways. It's not created by any one particular man. It's created by a patriarchal structure that's seeking to inequitably wield power by the few over the many, including quite many men, and certainly over members of all other gender identities. And our research and programs show then that this setup, this man box masculinity, links with many, many harmful outcomes. I know this is kind of the insight that prompts the whole meeting today, but it seems worth exploring in a little bit more detail. And this kind of activity is one that works really well in classroom settings all around the world. So when we are aligning ourselves with this man box way of organizing society, we see links with perpetrating and experiencing physical violence, bullying. We see risky sexual behaviors emerge from this because they are directly included in the man box messages. We see self-harm, sexual violence, and harassment. So at Promundo, and especially on the research team, a lot of my work is to try to figure out how to measure that this man box phenomenon is happening. And as we measure it, we really are able to produce a lot of useful insights to inform programming. So I just also thought folks might be interested to see how do we try to capture in research that those social norm processes around a very harmful masculine identity are happening. In a recent study that we conducted in the US, the UK, and Mexico, we conducted something we even call the man box scale, or like a list of 17 attitude items that speak to different components of a harmful masculine identity. And these are the first four: self-sufficiency, acting tough, physical attractiveness, rigid masculine gender roles. We ask respondents to the survey to tell us whether they agree or disagree, and how strongly they agree or disagree with these items. In addition to these ones, related to heterosexuality and homophobia, hypersexuality, aggression and control, we asked men in these three cases, and in many, many other forms of research in other locations in the world, the extent to which they really agree with these ideas. And then we're able to get a picture of each individual man's really embodying, accepting, walking that narrow scripted path of a very rigid man box masculinity. And we're able to then have some analyses and draw some conclusions. So what kind of conclusions feel relevant for the conversation today? Well, I titled my whole presentation with a quotation from this focus group participant from just down the street from where you're sitting in DC. He said, "How does society let men act? Because of society, the pathologies and powers that exist, men can only act a certain way. If you do not fit into the box, you are not labeled as a male," or one of the many labels that we have talked about. So clearly, he, in his life, he can reflect on being forced into the man box. And when he's asking, how does society let men act, I think he's using it in a rhetorical way to say society doesn't let men act in very many ways. You have to walk this very narrow path. But I really love this quotation because there's an obvious alternate meaning or answer to that question as well, which is that in many, many domains of life, society lets men act in pretty horrible, violent, discriminatory, harassing, power-wielding, inequitable ways with impunity. And so I think what this quote does is sort of in both of those directions, the ways that men's identities and actions are curtailed by social norms, and the ways that a lot of men's harmful actions, behaviors, and identities are encouraged or allowed to flourish with impunity because of the way that our social norming around manhood and sexual lives are set up. It's really the crux of what we're talking about today, I think. And then in addition to the qualitative side, on the quantitative side, we see over and over and over and over evidence that aligning your own identity, your own gender identity as a man with these rigid man box masculinity definitions has serious implications on men's own lives, on their likelihood of abusing alcohol, of risky driving behaviors, of suicidal ideation, of depressive symptoms, but certainly and dramatically on the lives of women and girls around them. So here what we've done is to divide up those respondents to the survey into 5 categories based on the extent to which they fully agree with all of those man box messages. And so you can see the men in the farthest right-hand column, who are the 20% of men who hew most strongly and most closely to the man box idea. Among those 20% of men, you have dramatic proportions, 63 up to 75% of those men tell us that they have perpetrated sexual harassment only in the last month. They've made a sexual comment or an action or physically touched a woman or girl they didn't know in a public place in a sexual way just within the last month. So it's a pretty undeniable link between these social norms and those social inequitable power structures and a lot of the harmful sexual behaviors, harassing behaviors, and violence that we're trying to end. And I mean, I realize that I'm quoting Meg Green and colleagues to a room where Meg Green is sitting, but this central insight from that amazing gender synchronized approaches paper from 2010 kind of coalesces what a lot of us have been saying this morning. Of course, we want to focus on mitigating and reducing those harmful behaviors, such as harassment, such as violence, such as risky sexual behavior. But the crucial thing that we do too little of is working to unravel the social norms, the structures, and the social order, one form of which is this man-box masculinity among many others in a patriarchal capitalist society. We must be addressing those root causes. And so in Promundo's work, what that most often means is taking what we call a gender transformative approach to educational curricula and campaigns in places all around the world. And basically, I'm sure that this idea came up many other times in your careers and in the presentations today, but to put a definition on what a gender transformative approach is, it means that it very directly is examining and questioning those social norms and structures, the imbalances of power between and among men and women and between groups. It's directly talking about the man box, working to unravel it, working to have young men and young women and participants in programs start to see gender and therefore start to reject it in all of its more harmful ways. So we're trying to take gender on and its power structures on directly rather than taking them as a given or rather than accidentally kind of going about our programs presuming that rules such as the man box rules are set in stone for all time, forever. No, they're not. They're socially created and therefore they're changeable. And these are a lot of the locations where Promundo and partners, in addition to all the great work done by colleagues in the room, have tried to take this approach, trying to integrate into school curricula, youth clubs, sports clubs, not unlike the India Parivartan example that Ali mentioned. Promundo's primary gender transformative curriculum is called Program H for men, Program M for women. There are numerous country adaptations. we're working hard to get more and more rigorous evaluations of this work, but the initial quasi-experimental studies that we've done find all sorts of encouraging results, particularly attitudes that support violence decrease everywhere that we've tested, but also relevant for today's conversation about SRHR, we see in India decreased perpetration of sexual harassment, as well as increased likelihood of using a condom. In the study in Brazil, we also see changes in HIV testing and in contraceptive use and other encouraging domains. And please, by all means, be in touch with me or others in the room if you don't have access to or you'd like to have a look at the program H&M curriculum itself. There are amazing activities in there. We're doing a new adaptation in the US as well, and we're very eager to share all of those actual sessions and workshop activities and things directly with you all. I kind of come to my summative slide of the elements that make for a successful gender transformative initiative. And to be honest, I've been cheating a little bit and adding new ideas here based on the presentations that came earlier this morning. So we can think of this as kind of a summative wrap up for a lot of good ideas here. Like I said, that first bullet, we have to take on these gender stereotypes very directly and not presume that anything about men's and women's identities are just set in stone. We can change these things. Number two, Ali and Nana and everyone were really emphasizing that peer group or that reference group influence, and we see positive, really powerful effects happen when a young man or young woman or a program participant is able to watch their social norms be challenged by the very group that create those norms, within their social group from whom they are looking for validation for their behavior. When you see that group changing alongside you, it's a totally different and more welcoming experience than thinking that just as one intrepid individual, you're going to subvert gender in your world and in your brain. That our programs actually include chances to practice hands-on skills and behaviors. I mean, we have courses where we're bringing in dolls and diapers and training new fathers how to change diapers, actually the practice in addition to the instructions and the messages. And then to just zip through the bottom of the slide here, it can't be one-off, it can't be very quick, just a few months, a few training sessions aren't going to do the trick. We need to provide a lot of support for the facilitators, the people in the room conducting something. It's not enough just to create a beautiful curriculum itself, but the folks in the room really need to be on the ball and really need to embody all of the more positive manifestations of gender that we're looking for, and bringing it out to the community level in terms, and this is, Nana was just describing this as well, tapping into those community resources that exist that support your process of change, having community level campaigns in addition to any small discussion groups you're doing. So then to kind of wrap it up and to bring it back all around, I think what we're looking for is, rather than one rigid box within which to fit, we want to explode the box where every person is able to shape a gender identity in accordance with their own individual beauty and individual preferences and individual expressions that might look something more like this, including for young men. And that the messages they receive from their peer groups, from their community, from the media, from places around them is not to shove them into a patriarchal box, but to say, you matter, I respect you, you are loved for who you are. And then I think it stands to reason that from that arrangement of society, we'd start to see reduction in violence, more equal partnership, more empathy, more healthy sexual relationships. So we call this a man box, one among many that we hope to see. And I will now pass the screen back over, and thank you so much for your kind attention.
This one's on.
Thank you. Wait, hello? Okay. All right. Thank you so much, Brian. And thank you so much, Jill, Nana, Ali. Great presentation. So We've heard a lot so far. We learned a lot about gender equity. We hear a lot about gender transformation, and really what gender equity can look like when it comes to men and boys spaces, and even spaces including for girls and women. One of the things that we often have learned at Advocates for Youth through our international programming has been, sure, the importance of sometimes gender segregated spaces, meeting the needs of both boys and girls. Intentional statement, obviously, there about gender binaries. One of the things, however, that we're really working toward trying to not do, though, is miss opportunities for when we can learn about one another's genders in the entire spectrum. And so one time when we were actually updating the technical guidance with UNESCO, for and with UNESCO, one of the things that came up from one of the participants, she said to us, you know, this is really great. When I was going through puberty, we're hearing a lot of great things, but it would have been awesome if I learned about what boys were going through in their programming. You know, she admitted she really didn't know anything. And so I kind of passed that burden intentionally over to you all, and even offer it in this space. And so if you were positive with that question of learning how other genders in the spectrum work, how to actually have inclusive programming, what would you have told that young person?
So I'll start. And this is sometimes where, is the sound working? As a parent, the rubber hits the road. So when my older daughter was about 10, she started a sex ed program at Montgomery County. And me being me, I said to the teacher, good luck teaching her something she doesn't know. And the teacher looked at me, and that day, my older daughter Danny came home from school and said, Mom, I did learn things I didn't know. I learned about wet dreams and ejaculation. And I was like, note to self. So I think, you know, with all things parenting, it's always a moving target. I always tell my two daughters that whenever, as they get older, I'm always behind, because I sort of like know it would have worked a year ago, but as they evolve, it's always evolving. So I couldn't agree more. I think it's critical, and I do think you managed to get that into the UNESCO 2017 guidelines, so kudos.
Thank you.
Yeah, I think that's a great point. The only thing I would add just from kind of our review is the importance of working both, you know, with people together and separately, because in some settings, let's say, you know, a rural context, you're working with men and women together, women may defer to men. And so, you know, men will speak up, women will be quiet. Yes, they'll learn, and there'll be a bit of kind of negotiation and understanding what each other are going through. But in order for women to be able to speak up and for men to be vulnerable and to really open up, sometimes they need those separate spaces. So I think our learning was that you need both.
And maybe just to build off that, Allie, we found in one of our studies in Rwanda, the Grow Up Smart study, that the boys and the girls did want to be together for some things, so they could hear what the girls were saying, and then vice versa, but then to go into their separate spaces to talk a bit more in detail. But something that we have learned in that and in other interventions too is going beyond messaging and sort of materials, and that conversational but also very tactile pieces. So they like doing activities together so that it's not just being talked at, especially with some of these uncomfortable topics, but they're drawing, they're doing like races, you know, they're going across the room, they're voting with their feet, and really this kind of active learning that works well, particularly for that younger age group as well. So I think just engaging them beyond, you know, adult learning and really making it fun as well. So, yeah.
All right. So I don't want to fill up too much of our time.
I guess the only thing I
Go
would
ahead.
quickly add. Oh, I'm sorry.
Yeah.
Oh, I'm so sorry. I wish I could be there. This is terrible. It's just that the situation is an example of unnecessarily carving up our lives and relationships according to gender, when really not only do they not need to be, but they just aren't. If you're talking about sexual health and sexual relationships, you need to know how all the bodies work. And so for purely in terms of the content not being accurate and comprehensive, that is an issue in that division. But then otherwise, yeah, absolutely defer to what the other panelists have said in terms of getting the style of the activity totally right and being really cautious about the dynamics, whether you have all sexes together in one class or separately. Certainly that would work less or more well.
No, you have no reason to apologize. That was so out of sight, out of mind. So my apologies to you, Brian. And thank you so much for adding that. And your point is very well noted, right? In order for us to actually learn together, we do need to learn about all of our bodies and how they actually interact with one another. And so I want to open the floor up to the audience. Or do we have any questions starting in the back?
Hi, this is Bethany Corrigan of Peace-Side. Thank you so much for a great panel. And I want I want to make use of the varied representation, especially across geographic areas, and ask, especially in integrated programs where the expertise of the staff in the field may be SRH first, adolescence and gender later. What type of ongoing sensitization, values clarification, knowledge expansion, like can you give us some best practices that you found through your extensive, and again, both with gender, with adolescence, with the intersection of those two?
Hello, I'm Meg Green from Greenworks. Thank you all so much. I enjoyed each of your presentations, and Brian, even though you weren't physically present, your charm and humility came through in your remarks. One of the things that stood out for me that I think Jill in particular touched on, but is kind of there in the background of all the other presentations as well, is how these messages about gender hierarchies are imparted so early. What are the prospects for getting some of this gender transformative stuff? I mean, by the time we're talking about sexual and reproductive health, it's way too late. What are the prospects for integrating some of this understanding in early childhood, in parenting, guidance, et cetera, and maybe integrating it in a way that isn't just about gender, but which is about fulfilling potential, emotional intelligence, etc.?
Hi, Sylvia Cabas from USAID. I'm actually kind of traumatized as the mom of a 4-year-old boy, how uber masculine he is at this point. I would like to share an example of a USAID funded project in Bangladesh that had a component on menstrual hygiene management, where the boys, as part of their curriculum, learned about reproductive health systems, including that of girls, and the evaluation afterwards showed that boys were actually less likely to bully and harass girls during that time, and it's no longer mysterious that the girls disappeared for a week, and of course that's another issue altogether, the link between MHM and school attendance and retention. But I thought that was a really great example of how the learning has to be reciprocal.
All right. Thank you so much. So we have 3 questions right now. The first is about best practices and what we have seen have worked. The second one is really about gender norms and hierarchies at an earlier age. We see that it happens at an earlier age. So what's the prospects for integrating in early childhood and really fulfilling emotional intelligence beyond genders? And then thank you for mentioning the USAID funded project and really kind of how we've seen reciprocal approaches work when it comes to gender equity and male engagement. So these questions are for any and all.
If it's okay, I'll start. So for best practices, I would say, particularly in terms of adolescents who are, have differing gender identities, I do not think we have really good models for adolescents. But I do think we do have from the HIV field a lot to be learned that could inform adolescent interventions. And to answer Meg's question, I agree completely. We need to, and it's actually something I asked on the webinar to GEAS about why are you starting at age 10? And their response was because that's when the brain changes, that's when this changes. And yes, all of that's true. I think it's a great opportunity, but I really think we need to start thinking how to do this as early as possible. So when I worked in human rights before I went to health issues, we had a program called Teaching Human Rights in Kindergarten. And I really think that's where we need to start on gender norms. And I don't know that that's happening anywhere.
I'll just make, just for Meg's question, I believe the potential in integration across sectors. So not only keeping it siloed in health, but I also possibilities for education in particular, and also the community level. So if there are parenting groups that are already happening in communities, we've seen this, and I've seen this in past work in agriculture and livelihoods, where there are already, and I believe even nutrition, if there are programs going on in the communities, often there are young children, there are specific school and or child engagement within community activities as well. And so layering gender as a normal part of discussion, I think, is really critical. It does tend to be this, you know, you're a gender technical person and it's very specialized, but I think in a sense the transformation is also destigmatizing even talking about gender. So how do you get people thinking that this is a normal thing to do, and really, you know, potential, I think, right now we've been talking a bit with some Senegal programs, USAID, Chemonics. We work with the Grandmother Project in Senegal, looking at how we can infuse this into the classroom with even early, I'm going to mess this up because it's from education, but I think it's early reading literacy or some, like one of those with 6-year-olds to even 8-year-olds. So I think that's potential. And then in terms of the values clarification question, something that we've done in several countries with different programs is to work with staff on looking inward first. And so when we start designing the interventions, and regularly, in some projects they did them, you know, every quarterly team coordination meeting, they would have these reflections. And sometimes it's as simple as one of the program managers will toss out a question. So men and women are equal. And then ask people, if you agree, go to this side of the room. If you disagree, go to this side of the room. And then basically have a conversation based on where people were standing in the room. So again, just getting people to talk and make explicit some of their own biases. And it got to the point where, you know, we would joke at year 3, year 4, and then our end of project meeting, where people would say things and the rest of the staff would say, that's not gender sensitive, you know, and really that from the beginning where they were interested, but it wasn't the norm for them. And to the end where we see them having transformed their own thinking, and even if they haven't completely, and this is difficult in a short time, changed, they are still learning to recognize and to bring to the surface. And I think that's important as well.
Just to add to the part about Senegal, because Nana and I have formed a team to intervene in this, despite this being beyond the scope of what was requested by USAID. So there's a program to teach all children to read in Senegal, and rarely, there's, gender just was not part of the picture. And it goes to sort of what are the images that children are presented with. The textbooks show the mother serving food and drink to the son who's lying back looking at the TV. And there's a gender message there. There are very few women teachers because the Senegalese teacher requirements are that you have to move as soon as you get your certification. But if you're a Senegalese wife, you're not in a position to say to your family, you need to move with me for my job. You will become divorced wife number 3. So these are sort of more gender issues that are needed starting at a very early age.
The one thing I would add that's kind of related to that, Jill, is beyond programming that's working with youth, I think modeling of gender equitable behaviors is something that the youngest of kids can see. So engaging men in fatherhood enables both male and female kids to see kind of a more equitable balance of power between their parents and see how that might play out. So that's another method.
And yet, to go back to what Allie just said, on a personal level, so in my first marriage, my husband raised kids, I worked outside the home, and so we were modeling this behavior. And my older daughter, again, comes home from preschool with this drawing showing me in the kitchen, which was never true. And the gender norms are so strong that despite seeing the reality, that they've moved on, both daughters have moved on since then, but it's beyond modeling.
Hey, Brian, did you have any response to any of the questions that were posited in the room?
The ideas coming from the other panelists are so good and mirror a lot of what I was going to say. If I had to add one small best practice idea to the first question, it would be something I touched on briefly in my presentation, and that is about just pay close attention to who exactly is the facilitator of any kind of youth programming. We spend sometimes a lot of our discussion and a lot of our brain energy thinking about the curriculum, thinking about the activities, thinking about the format of the thing, thinking about the evaluation methodology, thinking about the questionnaire, and then the actual thing itself, it gets a little bit lost. And the thing itself is somebody, whether it's us in the room or somebody from a partner organization working on our behalf, has to really deliver the messages effectively, and more importantly, like Allie was just saying, embody a sort of all different way of thinking and acting around gender. And I was involved in an evaluation of a Program H adaptation all across the Balkans region, and we did interviews with participants, and they spoke quite a lot about this. And in the locations where we saw really powerful program effects, all the guys in the program had a lot to say about the facilitator, that he's just like us, he's really cool, we want to be like him, you know. So that's one small thing to consider, and I'm glad that Allie brought up the fatherhood piece. I know, Meg, that you don't need anybody to tell you that fatherhood is an interesting direction for programming that might get at some of this early childhood gender norming issue, but I would just echo that one. It's something where I think the rationale in terms of the influence on the child is clear. I mean, Jill's lived experience notwithstanding, that you would tend to think on a population level, if household work and care work and just loving roles within the family are embodied equally by men and women and all parents of all genders, that would have some norming, shaping effect on child's lives. But it's also a pretty good entry point with men themselves. We don't always have a whole lot of luck going around to teenagers or young men around the world and saying, hey, do you want to come smash the patriarchy with us? Hey, do you want to come like demolish the man box and live in a more equal world? Like, that's not necessarily always what is getting men fired up to join in programs, but our research shows pretty consistently that fatherhood is an entry point, that young men do tell us, yeah, I wish I could spend more time with my children. Yeah, I wish I had a deeper relationship with my child. Yeah, I wish that I wasn't only defined by my economic role and I could be valued for work that I do inside the home as well. So it's a way, it's not the most radical way, and we need to push these guys beyond just thinking of what's in it for them, certainly, but it's a way that might bring some more young men.
Thank you. So we're running out of time, so we have time for one more round of questions. We can probably only get 2 questions answered. But before we do, if you have any questions online, please feel free to type them in the box. I see someone is typing, and also use moderator's privilege for 10 seconds. And so also, remember as we're discussing gender equity for all, the question I would love for us to at least take away with is really how can we create equitable programming for all genders, right? Theoretically, we can talk about, we know that there's something beyond the gender binary, but what does that actually look like in implementation and programmatic approaches? What does it look like when we're talking about gender norms, and some people don't have a gender to which identify a norm to? So when we're thinking about that, just something I just always want to put in our mind as a moderator when we're discussing gender and sexuality spectrums. What does gender norms look like for folks who don't identify within a gender? What does sexuality norms look like for folks who are, have sexualities across the spectrum? So we have 2 more questions in the room, and so starting over here.
Yeah, mine's half a statement and then kind of coming back to some of the programming y'all did. Working for the FACT project at IRH, we're seeing that we're asking questions about what people know about fertility. And we're seeing even adults not getting those questions correct about menstruation, about fertile windows, about onset of being a fertile human being for men and women. And I think the comment earlier, both by Jill and it was mentioned earlier by another panelist, around the idea that you have to teach both people the information about the other person's body is pretty critical. And it's something that we're seeing in our research right now, that people are not answering simple questions. So what we think are simple questions correctly, because these things then they perpetuate myths, misconceptions, not only about how people get pregnant, but also about how to avoid pregnancy. And I think that, what I'd like to hear more about is, as I read more about the topics, and mostly in the United States recently, actually, and even this morning there was an article that came across my feed about pornography from the New York Times, some of you may have seen the last couple of days, with adolescent boys. Like, how do we stagger this programming? We talk about the life course, but I feel like those life course jumps are too big. And how do we stagger this programming in a way that meets these boys where they are, and not just boys, but young women as well, in the right way to kind of give them the messages? And also, how do we create those safe spaces for the kid who's really quiet in the room to come back around to get his question heard or her question heard? So.
Hi, my name's David Morgan from Banding Global. This question is for Brian and anyone else who wants to chime in on this. I really like this example of the man box, right? Because I remember growing up as a young man hearing almost all of those phrases and those reinforcements about, what is an ideal man? So my question is, if we were to flip the man box and turn it into something positive, what positive ideals would we put inside the quote man box, and what positive reinforcement phrases and actions would we put on the side of that man box to motivate young men to become what the quote unquote ideal man would be?
Sorry, just to apologize to the people in the room that we are going to need to close up the Q&A, but I'm sure our panelists would be happy to chat with you after.
Quickly to Don's point, and I think, Brian, your point is, sorry, David, I think that's a fabulous question, so I really want Brian to weigh in on that. But for your point, even here in the US, even for someone like me who works on SRH, I had spent so many years trying not to get pregnant that when I finally was like, oh, it's just going to happen like magic. And the fact that I had to go to health providers and asked around, right, so really, why is this not immediate? What's happening? Oh, the antimalarials shouldn't do that. So it's much more complicated than we think.
No. Yeah, okay, I'll jump in. And I had a slide toward the end of my presentation, so I wonder if the organizers would even like let me share my screen again. I could bring this like the positive man box slide back up so we could look at it and discuss it, and you all can think of what else you would add to it.
Yep, we're doing that now.
But since time is short, I'll just kind of read from it as well.
Sorry, Brian, I don't
Really
think the question is less about
starting point-
what's in the positive attributes, which I think we got from your slide, but how do we transform the negative from the man box into the positive? Where do we intervene? How? What settings? What ages? What's the path forward? That's, I think, the question.
Okay, so the central idea then that it always comes around to for me is that the social norms of the man box are, it's that central box metaphor. We're trying to push everyone into a singular way of defining themselves as a man, a singular way of meeting expectations of what a man's role is and what sort of personality traits that person should have. Without the critical consciousness and critical education to see that for what it is, then quite a lot of young men and young women and members of all gender identities and other expressions kind of start to conflate those messages and those norms with male biology, and it's just miss the big picture that this norming process exists to serve patriarchal inequality, exists to serve the powerful men over the less powerful men, exists to serve all men over all women and members of other gender and sexual minorities. And that whole structure of singular, unequal, power-wielding masculinity needs to be demolished. Now, what does demolishing look like, and how can we put it in terms that are attractive to somebody? I think it's quite attractive, and probably you even referred to it in your question, to realize that you actually have the liberty to be your own special, unique flash of your imagination, your own individual expression of quirks and tics and preferences and loves and dislikes and clothing styles and speaking styles and types of relationships that you want. So the central social science idea, and I'm borrowing decades of researchers by saying this, is that there are as many masculinities that we should be fostering and encouraging as there are male-identifying people. And so the central one is primarily to let a young man really tap into who they are as an individual, what they like. Do you really want to have relationships that are marked by dominance and violence and silence and a lack of emotional intelligence? Or would you rather, in fact, have relationships, whether with your children, with your friends, with your partners, that are open and vulnerable and intimate and emotionally meaningful to you? And I think, to me, that's where it all starts. Young men and everyone needs to be told and reinforced as many ways as they can that they matter, that they're loved, that they're worthy of love, regardless of how they act or who they are according to some man box norms, that they may not have power in a patriarchal capitalist kind of sense, but they do have those great forms of power that, the Raising Voices SASA program and others, reinforce to us, that we have power with each other, we have power within ourselves, we have power to achieve great things according to our skills. So to tap into your positive power, to tap into the fact that you matter and you're worthy, to tap into the fact that your individual identity is valid regardless of the man box. I'm blathering a little bit, but I hope this is getting to what you were looking for, and I'm sure other people have good ideas in the room.
It definitely got to what we needed. Thank you so much, Brian. And so though we are needing to wrap up, I just want to thank the panelists for offering their time and their knowledge and experience to this, so please give them a round of applause. We also hear the wonderful applause online, so thank you for that as well. So just some takeaways. I know we really today talked through about creating programming that's gender inclusive, gender expansive, and equitable, right? So Ali, I really love the creation of the graphic between equality and equity, right? Like this notion of really understanding that there is a difference with, you know, actually creating what's equitable or what's equal versus what's equitable in responding to certain gender and intersectional aspects of folks' identities. I really appreciated, Nana, the example you painted because it made me think a lot about the privilege walk, right? Like talking to boys and girls within a binary about, like, yes, understanding what each other are going through, but also really thinking through what does privilege look like in a certain society? You know, how do you respond to that privilege? How do you create an understanding of that privilege? And Jill, as always, you just created so many great pictures for us based on your work about what you're doing and really how can we focus on men and boy engagement. And so for me, you know, and Brian, one of the things I obviously took away from you was the man box and really flipping the patriarchy on its head and really being able to discuss positive attributes from that. And I really hope that, you know, I know we have a couple minutes left and Chelsea would definitely take the mic, but really just hope this encourages you to continue your work and really allowing us to further our work on research and programming around gender equity in spaces. And I'm going to always keep pushing for us to think beyond the binary. In my LGBT health law and policy classes, you know, when we're talking about NCTE's data and the report and what's happening, you know, we still talk about the parity of issues, right? So you have a lot of questions and research in NCTE's data, but they will also even talk about that was a parity of data that was still used based on certain agencies' data. So it can still can go further and beyond that. Yeah, and just really pushing for a better research and programming. And I think this started that conversation. So thank you all so much for attending.
Just a huge thank you on behalf of the Gender COP to Preston and to all of the panelists for their participation. I'm going to let everyone go very soon. I just want to remind you of some of the resources that are available to you through the Gender and Positive Youth Development Community of Practice. For those of you who are members, this will be familiar, and for those of you who are not, maybe think about coming on board. We do webinars like this. This is a resource that's also available to each of you in your organizations. If you're interested in running a webinar, if you're interested in using our webinar platform to amplify your work, then we're more than happy to make that available to you, and you just need to contact myself or my co-champion Chisina through the Youth Power website. We also have resources available on the Youth Power website through the COP, through the other COPs. There's also cross-sectoral skills, youth and peace and security, and the youth engagement COP. We are looking for more ways to collaborate, and we're also happy, again, to amplify your work by promoting your resources on the Youth Power site. So again, you can contact us to do that. I just want to flag that we've just published the technical brief contributed to by many of our panelists and many of the people in the room today, including Nana and Jill, on positive youth development approaches to mitigate sexual violence and coercion among adolescents. And we did build quite a bit on the Promundo gender transformative approach and looked at building empathy, building choice, voice, and agency to both prevent and respond to incidences of sexual and gender-based violence among adolescents. So I think that is it. Keep an eye out on the Gender COP listserv. We will be talking about some of the topics that we'll be prioritizing this year for our learning agenda. One of the things that we did flag here today and that we'll be flagging going on is the theme of inclusive positive youth development, looking again at that evidence gap on marginalized youth, not just LGBTQI youth, but also young people marginalized along the vectors of disability, along refugee status or migrant status, ethnic minorities, indigenous youth, and youth offenders, and really looking for ways in which we can create learning and tools that will help make positive youth development as inclusive as it can be. So just one final thank you to all of you, and I hope you have a lovely day.
I was like, oh, I know.
Sorry to interrupt. Can I get a hold of Brian's presentation?
We're going to share it.
Okay, you just the email blast it out to me. Cool. Cool beans.
Yeah, I don't have it yet, so.